A great Islamic scholar, Ibn al-Qayyim al-Jawziyah, in his book, Zadul Ma'ad, Provision of the Hereafter, he said, one of the qualities as a healthcare personnel, you are expected to know the nature of the patient's body. Have that knowledge in you. You should know the person you are treating. And not only knowing the person you are treating, the types of disease that has befall this person and the causes of disease that has befall this person. That is number 2. Number 3, the stage and development of the illness that the person is suffering from. The stage and the development of this illness. You have to study it very well. Be it either you are from medical lab, either you are from public health, either you are from environmental health, or you are a nursing officer. You must take your time to study the causes of disease. You must take your time to study the stage and development of an illness. It's part of duty, or duties that Ibn al-Qayyim said you should follow. Another thing, physical constitution and age of the patient. Physical constitution. You should look at the physical outlook of the person. You should look at the stage of development of this person. His age determines what he is feeling. And not only this, the gender and occupation of the person. Sometimes there are illnesses and there are sicknesses, there are diseases that most at times befall women, not men. And there are diseases that are most, in fact, men are the most people going about with it. So we should understand your gender sometimes determine the disease you are going to contract. And not only this, environment and climate. He said, look at your environment. As a healthcare professional, you should know the importance of environment. You should guide the person to know the importance of his environment. And not only this, even the climate. You should take care of the climate before what? Before exerting a treatment to someone. And not only this, he said food and nutrition. Somebody's food should be advised. Allah said, فَلْيَنْظُرِ الْإِنسَانِ إِلَىٰ طَعَامِهِ. The child of Adam should look at what he will eat. أَنَّا صَبَبْنَا الْمَاءَ صَبًّا. We have sent down the rain in torrents. ثُمَّ مَاذَا؟ ثُمَّ شَقَقْنَا الْأَرْضَ شَقًّا. We've broken the earth so that these plants will come out. ثُمَّ مَاذَا؟ وَأَنْبَتْنَا فِيهَا حَبًّا. Allah said we have what? We have made all these seeds to germinate. ثُمَّ مَاذَا؟ وَعِنَبًا وَقَضْبًا. Allah said, eat enough, take enough bread, eat it very well. وَقَضْبًا وَزَيْتُونَ. The olive oil and the olive seed, take it well. So Allah said, وَنَقْلًا. And the date palm, you take it. This is what Allah said. Devino, Allah said take it. And not only this, and some other things like this. So your food and nutrition, balance your diet. You must advise your client to know how to balance his diet. And not only this, sleep and wakefulness. He should have what? Enough time for sleep, and should wake up at the appropriate time. And not only this, you should take care of his what? Mental wellness and emotional well-being. Mental wellness and what? Emotional well-being. Mental means has to do with mind. Emotional well-being has to do with mind, has to do with his mind, how he feels about things. You should know this as a what? As a healthcare professional. And not only this, strength of immunity. You should know the strength of his immunity. Most especially those of you in the lab. You should take your time to understand these things. Strength of the immunity. And not only this, season and time of what? Of the year. Because season and time of the year determines what? It determines some of the sicknesses and diseases that we experience. As a healthcare professional, take your time to know what are the problems in the rainy season period. And what are the problems in what? In dry season. Let me ask you one of the problems in dry season. What are the diseases we mostly encounter in dry season period? So, let me help you. Meningitis. Yes? Did you agree with that? You are the personnel. You must respond. Did you agree with that? In the rainy season, we have malaria. We have malaria and diarrhea. Take your time to understand at each and every time which of the diseases befall people and so. And not only this, mode of living and habits. Some people, they have bad mode of living and they have bad mode of habit, and they have bad habits in doing things. You should know how to guide people on these things. And not only this, previous medical history. You should take your time to ask the history. That is what we call in counseling history taking. You must know the history of the patient, not the history of the problem, before you now come in and support the patient. You should, as a healthcare personnel, you should take care of this. And not only this, respond to past treatment. Responding to past treatment. Is this patient responding to past treatment? Has he responded to past treatment? You ask, you should know these things. Ibn al-Qayyim al-Jawziyah said, take your time to ask him. To know this thing, as a healthcare professional, you should have this knowledge. And not only this, duration of the illness. Duration of the illness in the body of the person. Take your time to know the duration. Are we following? It is part of what Ibn al-Qayyim said we should tell you. Islamic scholar, great Islamic scholar. He said you should take care of this as a healthcare professional. And not only this, type and amount of medication. Which type of medication are you administering? Amount, the quantum and the quantity of the medicine you are administering. You should take care of this. He said you should know when and where to administer, how, quantity of the medicine you are administering. He said you should take care of this. Method of administration. He said you should take care of the method. Are we getting what I'm saying? Method, very, very important. Sometimes we ingest. Sometimes we what? We swallow. Sometimes we what? We inhale. They have different method of administration. Yes, different method. He said, Ibn al-Qayyim said, take care of this, take note of this on how you are expected to administer. And not only this, timing of the therapy. Timing is very, very important. Are we getting it? It's very, very important. He said, take care of the timing. Know exactly when to administer, know exactly what to do. And not only this, expected outcome and the side effect of the medication. Expected outcome and the side effect. The last thing is the spiritual and moral condition of the patient. You should know this. The spiritual condition of the patient and the moral condition of the patient. Are we getting it? Unless if you take your time to know these things. I think with these small things that we have mentioned, in the course of discharging your duty outside, I believe if you follow these teachings, Allah will help you and Allah will support you in your endeavors. We pray may Allah support us in our endeavors. Assalamu alaikum wa rahmatullah.